Hi everyone, Namaste and welcome to TimesHealth Plus. I am Dr. Sneha Rathi. I am a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. I combine the techniques of physiotherapy and yoga and give solutions to my patient for their better health and joint health. So today we are going to talk about different things like walking, our alignment, balance. So first of all, before starting the session, I would like to ask you all, how many of you walk on an everyday basis? Can you tell me in the comment box? How many of you walk on an everyday basis? Rajkumar ji says daily. Anjali ji says not every day. Okay. Ravinder ji, I would come back to your question in a while. Murthy ji says I do. Anjali ji says alternate days. Soumya ji says I do. Sanyal ji says yes, about 12k steps. Mahatma ji says daily. Murthy ji says since I have a dog, okay. Jijit ji says every day. Reema ji says not every day. So I think majority of you are walking on an everyday basis. But mostly nowadays what we do is we walk for completing our steps. But do we actually consciously walk on an everyday basis? Do we take care of what posture are we walking, or the way how we are walking? Are we actually looking into that? So today we are going to talk about the different phases of walking and how different asanas can actually help in making you walk better and make it more conscious and much better in alignment and balance wise. So today we are going to discuss that. Another thing that we are going to discuss is something that is a very prevalent condition nowadays. It happens because of sitting for a long time, and right now I'm sitting on a chair, so it happens because of sitting for a long time. That is also known as the dead butt syndrome. So what happens is, when you are sitting for a long time, your buttock muscles actually become inhibited and they stop working on very efficiently, and that causes sometimes pain in the lower back, sometimes pain in the buttocks, or pain that is radiating in the legs. Have you heard of this term before? The dead butt syndrome. That is very common these days. You might have also experienced a certain feeling of numbness in the legs after sitting for a long time. So that is nothing but dead butt syndrome. So how do we actually tackle that condition? We are going to also look into that factor. And I would also like to ask you, how many of you actually take stairs instead of an escalator? When you have an escalator or an elevator present, do you actually take staircase? How many of you do that? So do you take staircase or you prefer escalator or elevator? You can write it in the comment box. What do you prefer? Anuj ji says yes, okay. Sanyal ji says yes, if time is not a constraint. Ankur ji says occasionally. Jijit ji says elevator. Murthy ji says elevator. Rajkumar ji says stairs. Priyanka ji says elevator. Anjali ji says elevator. So most of you prefer elevators instead of staircase. And do you know there are a lot of benefits of climbing stairs? It actually helps in strengthening your legs, leg muscles. Okay, it also improves your balance, because there is a phase in staircase climbing when you are actually standing on one leg and lifting the other leg up. So it improves your balance. So there are a lot of benefits of taking staircase over elevators. But because elevators are available everywhere these days, we are preferring elevators. However, I would recommend at least once a day you climb stairs on a regular basis so that you maintain your leg strength well. So today we are going to discuss more about the alignment, about how the different, what are the asanas that are actually going to help you improve the walking pattern, what are the different asanas that are going to counter the dead butt syndrome. So we are going to look into that. So before going into that, let's first understand the walking pattern, okay? How do we actually walk? So in order to improve our walking pattern, we need to see how do we actually walk. So here you can see there are different phases of walking. When we are walking, we actually first lift our leg up and put our heel on the ground. Okay, that's the first phase of walking. We lift our leg up, put our heel on the ground. Then what we do is we go into foot flat, where we are bearing weight on the front leg and we are lifting the heel of the back leg. Okay, then what happens is we want to lift the back leg and keep it forward. So we take all our weight on the front leg and we lift our back leg and keep it forward. Okay, so there is a phase where we are taking the toes off and lifting the leg and keeping it forward, again into heel strike. Okay, so these are the different phases of walking. First heel strike, then foot flat, then we take our weight on the front leg, lift our heel off of the back leg, then we take our entire weight on the front leg, lift our toe off and lift it, swing it and keep it forward. Okay, these are the different phases of walking. Along with this, we also swing our arms while walking. Okay, many people actually keep their arms very stiff. I have seen people walking with their arms very stiff, which is not a good thing to do. Okay, you need to swing your arms while walking. Also, now in this, as you have observed, I have used a lot of ankle mobility over here. Okay, so what are the requirements for walking? What are the different needs in your body that are required for walking? First thing is the ankle mobility. So you need to have a good ankle mobility, because you're going from heel strike to foot flat, then taking weight. Also you are actually plantar flexing your ankle and lifting it off and keeping it forward. Ankle mobility. Next is what is required is knee mobility. So you need to, because you need to swing your leg forward, so you bend your knee, lift it up and keep it forward. Okay, so what is required is knee mobility and strength also. Another thing that is required is hip mobility, because we are keeping the hip, bending it and keeping it forward. So hip mobility as well as strength. Strength of the legs, because you are taking the entire weight on one leg. Okay, so that is very, very important. Alright, and then the arm swinging motion, that is very important. So all these phases of walking we need to train, and this can be trained through different yogasanas. So today we are going to understand how we are going to train the walking pattern through different yogasanas. Also, one thing that is more required in walking is balance, because if you don't have balance, you may not be able to transit from this to this. Okay, so you're going to stand on one leg and then you're going to keep your leg forward. So balance is a very important factor in walking. Hip strength is very important in walking. I have seen in my clinical practice many people who walk with a lateral sway of the trunk like this. So that is because their hip strength is not very good. So this is also another need for walking. So we need to train the hip strength as well. Okay, so these are the different factors that we need to train while walking. So today we are going to look into the asanas, which are going to not just improve our walking, but also improve our glute muscle strength or the buttock muscle strength. Okay, because as I explained about the dead butt syndrome, so we are also going to look into that. And in the previous videos, we have seen how to improve our spine alignment. Okay, so those asanas can be done for a better spine alignment, although I am going to cover one or two asanas which are good for better spine alignment. So because you can't walk with a kyphotic posture, this is not the correct way to walk. You need to have an erect spine in order to walk properly. Okay, so this is another factor that is very important. That comes to the question of Ravindra ji. So if you have low back pain and upper back pain, there are some videos which we have done previously wherein we have talked about how to take care of spine. You can refer to those videos. I am also going to cover one or two asanas in this video in order to help you understand how you can take care of your spine better. Alright, so I would request all of you to get your mats And we are going to begin with some asanas which are going to help us make our walking better. While Zen Ji says how many stairs we need to climb in a day. So I would say that you start with one flight of stairs in your building or whatever locality you are staying. So about 10 to 12 stairs, one flight of stairs initially. Gradually you can build up your endurance and stamina as your joints and muscles allow. So it all depends on your age, your muscle strength, okay, how are you exactly. So that can decide how many flight of stairs you can climb. It's very important you be comfortable and do not get any joint pains and aches while doing this. So that is what is important. So you can start with one flight of stairs, gradually increase it to 2 to 3 flights of stairs depending on your stamina and other things. Anjali ji says, I have ligament tear in ankle, that means I should avoid walking for some time. Okay, can you also suggest asanas for good posture? We have already covered asanas for good posture in the previous videos, so you can refer to those videos. There are many asanas which we have discussed for a better posture and spine health. Gigi ji says, while walking I get some burning sensation just above my left knee. What is the solution for this? So the burning sensation, we need to actually assess why this burning sensation is coming. So it might be due to overstretching of some muscle, or it might be due to, I do not know your age and other things. So it might be due to some degenerative conditions. We need to actually find out what is the cause of this burning, and then we can address that. Okay, so let's start with the asanas. So we'll start with warm up first. So take a 1 foot distance. Let's do conditioning first. So that is Sthit Prathanasana. So over here we keep both the legs together. Look at one point in front of you. Now slowly join your hands in front of your chest. Keep your spine erect and straight. Chin parallel to the ground. Slowly close your eyes. Focus on your breathing and your body. If you feel you're going to lose balance, you can keep your eyes open and keep it focused at one point in front of you. Slowly open your eyes and relax your hands. So this was a very good conditioning practice for improving your balance as well, because our balance is dependent on mostly 3 factors. One is the inner ear, okay, so that is responsible for balance. Second is our vision, that is responsible for balance. And third is our muscles and ligaments, which give us our feedback to our brain that we need to maintain balance or what position they are into. Over here we actually obliterated the vision and we are dependent on the inner ear as well as the muscles. So this is what is going to actually improve our balance. So this is one good practice for improving our balance. But in case if you are not able to maintain the balance with your eyes closed, it is recommended that you keep your eyes open while doing this practice. Now let's start with single leg balancing asanas so that our balance improves while walking, as it is a very important factor. Okay, so first we are going to start with Ekpad Asana, wherein we are going to bear weight on one leg and we are going to lift the other leg and keep it on the inner thigh. Okay, so like this, you can use your hand support to lift and keep it on the inner thigh, and slowly what you can do is as soon as you maintain your balance, you can join your hands in front of your chest. So stay there. 1, 2, 3, 4, 5, 6 and relax. You can keep a chair beside you in case you have a tendency to lose the balance, so that as soon as you lose balance you can take support. Okay, so now the other leg, we will just take support of the chair, lift the other leg and keep it on the inner thigh, maintain the balance and slowly join our hands in front of the chest. 1, 2, 3, 4, 5, 6 and slowly relax and release. Okay, so this is how you can do Ekpadasana. This is a very important asana. Over here what is very important is when you are taking the leg up, your hip should not fall like that. Okay, so this falling of the pelvis should not happen. This indicates that there is some muscle weakness in your hip. So what you do is you correct your posture by straightening your knee and tightening your glute muscles, maintain your balance and then slowly join your hands in front of your chest. Maintain the balance. 1, 2, 3, 4, 5, 6 and slowly relax. Okay, repeat it on the other side. Keep your leg on the inner thigh. Again, no pushing of the hip like that. You need to have a straight hip while maintaining this asana. Once you have maintained your balance, you can slowly join your hands in front of your chest. Stay there. 1, 2, 3, 4, 5, 6 and slowly relax and release. So this is Ekpadasana. Now next is you are going to go for Vrikshasana. Okay, so what we are going to do is we are going to lift our leg and keep our leg on the bone that is present over here or the upper thigh area, okay, like that, and point our knee downwards. So this is Vrikshasana. Again a single leg standing pose. You can take support of a chair or something. Once you have maintained your balance, you can raise your hands up and join. Stay there. 1, 2, 3, 4, 5, 6. Slowly relax and release. Okay, same thing, repeat it on the other side. What we are going to do is lift the leg up, keep the leg on the upper thigh area, point the knee downwards. Once you have maintained the balance, take your hands up, maintain. 1, 2, 3, 4, 5, 6. Slowly relax and release. Okay, so this is actually going to challenge. So what we are doing is we are putting the leg into different positions. With one leg taking all the weight, we are putting the other leg into different positions. So this is also one way of challenging the balance. So which is a good practice to improve your balance. Let's lift the other leg again. Repeat this again. Lift the leg up. Keep it on the upper thigh area, pointing the knee downwards. Once you have maintained your balance, slowly take your hands up. 1, 2, 3, 4, 5, 6. Slowly relax and release. Okay, now do it on the other side. Lift your hands up again. 1, 2, 3, 4, 5, 6. Slowly relax and release. So we have done this. So we have taken the leg onto the side once and we have taken the leg onto the front once. Okay. Now let's challenge the balance by taking the leg fully front and lifting it up from the front. So this is nothing but standing Pavan Muktasana. So what we are going to do is take weight on one leg, lift the other leg up and take it towards your abdomen. Hold the position. 1, 2, 3, 4, 5, 6. Slowly relax and release. Okay. Now we are going to lift the other leg up. 1, 2, 3, 4, 5, 6. Slowly relax and release. We'll repeat this once again. So this is again a very good asana because we are challenging. It's almost the same kind of movement that we use in walking. We are lifting the hip up, okay. So that's a very good practice to make your walking better. So lift up again, balance on one leg, lift the other leg up. 1, 2, 3, 4, 5, 6. Slowly relax and release. Lift the other leg up. 1, 2, 3, 4, 5, 6. Relax and release. Okay. Akhilesh ji says, doctor advice for knee surgery. Can it be cured with yoga? So it all depends upon exactly what is the situation of the joint, okay, why he has advised knee surgery, what stage of arthritis or whatever condition that you are suffering from you are in. It depends on that whether it can be cured through yoga or it needs surgery. So we need to know the reports before we can comment anything on it. Beena ji says, can we do these asanas if we have sciatic pain? Yes, you can do these standing postures even if you have sciatic pain. Make sure that while performing these asanas you are not experiencing an increase in pain, okay, then it is absolutely safe to do these single leg standing asanas. Next we are going to, so we have taken our leg from the side, we have taken up from the leg from the front. Now we are going to take our leg up from behind, so that is Nataraj asana. So over here what we are going to do is, we are going to bend the knee, hold the ankle, slowly try to push the ankle away from the body, take the hand up, other hand up and balance on one leg. 1, 2, 3, 4, 5, 6. Slowly relax and release. Okay, repeat it on the other side. Bend the knee, hold the ankle, lift the leg up from behind. 1, 2, 3, 4, 5, 6. Slowly relax and release. So this is very good asana to stretch the quadriceps muscle, also activate the glutes. So as I talked about dead butt syndrome, it's actually very good to activate the glutes, but you have to make sure while doing this asana you're not getting too much strain on the lower back. So only lift the leg up how much you feel comfortable, okay. So we are going to repeat this again. Bend the knee, hold the ankle, lean forward slightly and lift the leg up from behind. Stay there. 1, 2, 3, 4, 5, 6 and relax. We will repeat it on the other side. One, 2, 3, 4, 5, 6. Relax and release. So this was Nataraj asana. Next we are going to challenge one more asana we are going to do, that is Garuda asana. Only legs we are going to perform, not the upper arm, just for the improvement of balance of the legs. So what we are going to do over here is, we are going to bend one knee, slowly twirl the leg around the knee, take support of a chair if required. When you have maintained the balance, you can release the hand and maintain. Yeah, stay there. 1, 2, 3. Okay, I'll repeat this again. Stay there. 1, 2, 3, 4, 5, 6. Okay, so maintain your balance. It might take some time to achieve this asana, so you can take your time and do it. Repeat it on the other side. Maintain your balance. 1, 2, 3, 4, 5, 6. Relax and release. So this is a very challenging asana because we are spiraling the leg around the other leg. Okay. So, and you are also bending the knee. So you need a lot of knee strength, hip strength as well as balance in order to achieve this pose. So you can take your time to get the balance first. And then take your hands off and maintain the pose. 1, 2, 3, 4, 5, 6. Relax and release. Okay, we'll repeat it on the other side. First, just twirl your leg around, lock your ankle on the calf. Maintain your balance. Stay there. 1, 2, 3, 4, 5, 6. Relax and release. So these were some of the asanas which are on single leg. Okay, so single leg standing, and where we are taking the leg into different positions. This is going to improve the balance a lot. So a regular practice of these asanas can help in improving the balance. Next we are going to go for Virabhadrasana, where I am going to explain how a person with dead bud syndrome or inactive glutes actually performs a Virabhadrasana. Okay, so in Virabhadrasana we are going to take a distance of 3 to 3.5 feet. We are going to turn the foot outside, right foot outside, take our hands at the shoulder level and slowly bend the knee and turn our head towards the right hand. Stay there. 1, 2, 3, 4, 5, 6 and relax, come back. So a person with inactive glutes, actually I have seen many times in my clinical practice, people performing Virabhadrasana like this. So what happens is the back is bent forward and the glutes are facing backwards. Okay, so it's like this, which is not a good way to do Virabhadrasana because it's going to create a lot of low back pain issue or knee issues. Okay, so you need to make sure when you're doing Virabhadrasana, you're not in this position, but you get yourself on your hips properly. Okay, not by extending the back. Do not get yourself back like this, but getting your hips under your body properly. Okay, so your alignment has to be really good while performing Virabhadrasana. So let's do it with the correct alignment now. So take 3.5 foot distance. Turn your right foot outside. Take your hands at shoulder level. Inhale. Exhaling, bend your right knee. 1, 2, 3. Look at your right hand, breathe normal. Stay there. 2, 3, 4, 5, 6. Inhale, come back. 1, 2, 3. Exhale. 1, 2, 3. Repeat it on the other side. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Okay, a very good asana to actually do get a lot of hip opening as well as hip strength. Okay, so again, turn your right foot outside. Inhale. 1, 2, 3. Exhale. 1, 2, 3. stay there, 2, 3, 4, 5, 6, inhale, 1, 2, 3, exhale, 1, 2, 3. We will repeat it on the left side. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. So Ravinder ji, this is a very good asana for low back pain. Okay, so if you do it in the correct alignment, it will actually strengthen your pelvis and your core as well as your glutes, which will support the low back in a very good way. Okay, so this was Virabhadrasana. Now let's move on to some asanas which can be done in sitting position. So first we would sit on a chair, and I would like to show you certain asanas. So first one is the squat position. Okay, so what you can do is you can practice a squat position on a regular basis on a chair. Okay, so what you do is keep your hands in front of you at the shoulder level. Go down up till the level of chair without touching your buttocks on the chair, and come up again. Okay, so you can practice this way, the squats. So keep 1 foot distance between your feet. Take your hands at the shoulder level. Go down up to the level of the chair. Do not touch your hips down on the chair seat. Stay there. 1, 2, 3, 4, 5, 6, and up. If in case you are not able to go down that much, you can go down as much as you feel comfortable with. Do not do this. Okay, if you try doing this, again you are going to have a lot of low back pain. This thing just indicates that there is some weakness in the legs. So make sure that you have a straight back as much as possible, and then you squat down. Stay there. 1, 2, 3, 4, 5, 6, and come up and relax. So you can practice this on a regular basis to improve your sit to stand mechanics, okay, and to improve your leg strength. Another thing that you can do to have a better posture while standing and walking is you sit on a chair, keep a 1 foot distance. Okay. Once you stand up from the chair, go into Talasana position directly. Stay there. 1, 2, 3, 4, 5, 6, and relax. So this way what will happen is the entire posterior chain muscles, all of them will get activated. Because we have been sitting for a long time, the muscles might be a little inactive. So as soon as you stand up, you go into Talasana and stay there. 1, 2, 3, 4, 5, 6, and relax. So this way what you can do is, you can on a regular basis, whenever you are getting up from the chair, you can practice Talasana so that your body becomes erect. From a slouching position in sitting, you become more erect, and then you start walking or doing any of the activities. So this is a good way to train your spine to be more erect while walking or standing. Next we are going to go for some sitting postures. So I would request all of you to sit down. If you are not able to sit down, you can sit on a chair and do these positions, whatever is possible. So first let's do something that will make our spine more erect, because an erect spine is a requirement for walking. So first one is Parvatasana. In case if you can sit in Sukhasana, it's good. If you can sit in Padmasana, that would also be good. So whatever is comfortable, you can take that position. If you are unable to sit in Padmasana, sit in Sukhasana. If you are unable to sit in Sukhasana, sit on a chair with legs hanging down, that's also fine. Okay, so Parvatasana is very simple. Here we are elongating the spine, making our spine more erect. So you keep your hands by the side. You inhale, lift both your hands up, join your hands and stretch them upwards towards the ceiling. stay there. 1, 2, 3, 4, 5, 6. Slowly relax and release. Okay, here while taking the hands up, you need to inhale, and while taking the hands down, you need to exhale. In between, you can breathe normal. So keep your hands again by the side. Inhaling, take your hands up. 1, 2, 3. Normal breathing. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. So this is simple Parvatasana. You can do its variations also to improve the mobility of the spine and to help reduce any kind of pain in the spine that you have. So Ravinder ji, this is a very good asana for helping you relieve the spine pain. Okay, so again, now over here what we are going to do is we are going to take our hands up. We are going to bend sideways. Stay there. Come back to the center. Bend to the other side. Stay there. Come back to the center and relax. Okay, so let's do this with counts. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale, bend sideways. 1, 2, 3. Normal breathing. 2, 3, 4, 5, 6. Inhale, come back. 1, 2, 3. Exhale. 1, 2, 3. Inhaling, bend towards the other side. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. So this is going to actually improve lot of arm strength, shoulder strength, and also make our spine elongate better. Okay, so it's a very good asana for helping an erect spine. Now next what we are going to do is we are going to do a third variation of Parvatasana, wherein we are going to turn our body. So what we are going to do is take our hands up, twist or turn your body to one side, come back to the center, twist to the other side, come back to the center, and then relax. So there is no holding over here, no holding of the position, just come back to this twist and come back to the center. So let's do it with counts and breathing. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Alright, so this was a variation of Parvatasana, again which is going to also help in our walking, because our walking also includes some amount of rotation of the trunk. Okay, so that will be helped by this asana. Okay, so we are going to repeat this one more time. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Inhale. 1, 2, 3. Exhale. 1, 2, 3. So a very good asana for elongating the spine and for spine health. So this was Parvatasana. Next we are going to go for Ushtrasana, okay, which will help in improving the leg strength, hip strength, as well as improving chest opening and improving the upper body posture. So while sitting as well as standing, it will help improve the upper body posture. So what we are going to do is over here, we are going to sit in a kneeling position. We are going to keep our hands behind with our thumbs facing the toes and fingers facing outwards. We are going to bear weight on our hands as well as feet, and slowly what we are going to do is push our legs forward. Drop your neck behind. Come back to the starting position gradually. Gradually lifting your head and neck back, and gradually when you are going into the position, make sure that you are gradually lowering the head behind, not suddenly. Otherwise, you might experience some dizziness. And those who have vertigo, I would recommend they do not do this asana with the head hanging backward. Okay. So, we will repeat this with counts and breathing. Keep your hands behind. Inhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Exhale, 1, 2, 3. It's difficult to stay in the position and count as well. Okay, so I had kept my head little up so that I could count. Otherwise, if you keep the head hanging backwards, counting becomes very difficult. So, I am not going to count for 6 counts over there. You just have to count it in your mind, and we will repeat this posture once again. There is another way to do Ustrasana also actually, wherein you can sit in kneel sitting position and then just lean behind, hold your heels and push yourself forward. But this actually is more better if you want some lumbar extension. So, if you want to help your spine, that kind of position is better. But if you want to actually strengthen your legs and hips, this pose is much better. So, both are different ways of doing Ustrasana with different benefits. Okay, so we will repeat this one again. Keep your hands behind. Inhale, 1, 2, 3. Stay there. Exhale, 1, 2, 3. For a counter pose, you can bend forward and do balasana. And slowly come back to the starting position. So, even balasana is going to help elongate the spine. So, it is a very good pose to actually correct any kind of postural problems that you may have. So, this was another pose which will strengthen the glutes, thighs as well as chest opening and improving the spine posture. Okay. So, this was Ustrasana. Next, we are going to do an exercise wherein we go into quadruped position. This will activate the entire posterior chain, very good for walking practice. What we are going to do is, we are going to lift the leg up and opposite hand up. Stay in that position, 1, 2, 3, 4, 5, 6. Slowly relax and release. So, the entire posterior spiral chain that we have from this hand till the opposite leg, everything gets activated. Okay. We will repeat it on the other side. 1, 2, 3, 4, 5, 6. Relax. Now again, inhale, 1, 2, 3. Stay there, normal breathing, 2, 3, 4, 5, 6. Exhale, 1, 2, 3. Other side, inhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Exhale, 1, 2, 3. Relax and release. So, this is very good pose. Again, if you have any scapular disturbances, a very good pose to train your scapula and the spine as well. Okay, so it activates the entire chain. All the posterior leg muscles also get activated in this pose. Next, we are going to go for some 2 or 3 poses in lying down. So let's lie down. Always lie down on your side and turn on your back. So the first pose is Setu Bandhasan, wherein you will keep the legs shoulder distance apart. Slowly inhaling, push your hips up and stay there. 1, 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Again, a very good pose for glute strength, hamstring strength. Okay, so it's going to help your knees as well as your hips. We will repeat it again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. One last time. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. So this was Setu Bandhasan. Next, we are going to go on a lying down position, on the abdominal lying down position. And what we are going to do is Shalabhasan. Okay, so Anil ji, these asanas will help in hamstring muscles also. Yes, just now what we did Setu Bandhasan, and now what we are going to do Shalabhasan, those are going to help your hamstrings as well. Okay, so now keep your chin down on the ground, keep your hands by the side. In Shalabhasan, what we are going to do is, we are going to lift the leg straight up, stay there, and slowly relax and release. Repeat it on the other side. Relax and release. So make sure when you're doing Shalabhasan, while lifting the leg, you're not lifting the upper body also. You have to keep the chin in contact with the ground. Okay, so now we are going to do Shalabhasan with breathing and count. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhaling, lift the other leg up. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. If lifting the leg is difficult, you can keep your hands under the thighs, okay, and then you can lift the leg up. So inhale, exhale, 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhaling other leg. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. So this was Shalabhasan. Very good for your hamstrings, for your glutes, okay, and your calf muscles, as well as your lower back. Okay. Next, we are going to do Bhujangasana, which is again important for an erect spine. Okay. Plus, there is a lot of stabilization from glutes in Bhujangasana. So it's again a very good pose for the dead butt syndrome. Okay, so what we are going to do is, we are going to keep the forehead on the ground. Keep our hands beside the chest. Inhaling. Lift. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Mind you, I am not using my hands too much. I am using most of the strength of my lower back. So as much as the strength of the lower back I can use, I am coming up only that much. Okay. We'll repeat it again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Another thing to notice over here is I'm not flaring my elbows like this. So I'm not coming up like this. I'm keeping the elbows very close to my body and they are facing backwards or upwards. Okay. So we'll repeat this once again. Legs together. Legs also should not flare apart. They should be held together. Okay. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay, now we are going to turn on our back and we'll just do one breathing technique to relax ourselves. So just keep your knees together, feet apart, knees bent like this, knees together and feet apart. Keep one hand just below the abdomen, just above the navel. Keep the other hand on the ground. Now slowly inhale and exhale. As you inhale, your abdomen should rise. As you exhale, your abdomen should go down. So now I'm going to give you 3 counts inhale and 3 counts exhale. We are going to do 5 rounds of breathing. Inhale. 1, 2, 3. Exhale. 1, 2, 3. 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 Come back to normal breathing. Slowly turn on one side and lie down with your legs slightly bent, one hand under the head. This is also known as Dridasana. Now slowly take support of your other hand and get up and sit in Sukhasana. Okay, you can slowly open your eyes and keep your hands on your thighs. Reema ji says, will this asana put pressure on your lower back? The Bhujangasana that we just did, where we were not putting a lot of weight on our hands, yes, definitely it's going to put some pressure on the lower back because the lower back muscles are working. But that pressure should not be equal to pain. So you should not feel it as pain. So only come up as much as you don't feel any kind of painful sensation in the lower back. So pressure is okay, but not pain. GCG says, please let us know the address, take care of ankle pain caused by walking to continue regular walking. So the asanas that we did today, that were single leg standing asanas, they will actually train the ankle a lot, okay. So that will help in improving the ankle strength. Also in the last session I have covered the knee and ankle exercises and asanas. So you can refer to those asanas and that will help your ankle to become better in their strength as well as mobility, and that can reduce the pain while walking, okay. Also you need to make sure that you are wearing good shoes while walking. If you are walking barefoot, okay, so you need to make sure how is the surface area that you are walking, is your ankle used to that kind of surface which you are walking, and if you are wearing with shoes, make sure you are wearing a good quality shoe, okay. It should not be too tight, not too loose, okay. So there are some specifications for shoes as well that needs to be taken care of while walking. That will help reduce any kind of ankle or heel pain that you are experiencing. So I have a challenge for you. The challenge is, what you are going to do is, you are going to sit on a chair, and every time you rise up from the chair, make sure you stand in Talasana for at least 10 counts, okay. You can click a picture of this and post it on Instagram. Also do follow TimesHealth Plus on their Instagram and YouTube channels, and make sure you stay updated with their tips and recommendations that you get on TimesHealth Plus. So this was all for today. Today we discussed about what are the asanas that are going to help improve our walking, and make sure that now onwards whenever you are walking more consciously, making sure you are swinging your arms, making sure that you are walking erect, as well as making sure that you are putting your feet properly on the ground, lifting your knee up, not locking your knees, okay. So make sure that you are taking care of all the aspects of walking. Alright, so I will see you next time with some new techniques and new conditions that we are going to come up with. So ensure that you are joining next time as well. Till then, stay present, move gently, and make sure you take care of yourself. See you next time. Thank you and namaste.
And cut.